In Malawi, Malawi has emerged as a leader in improving women's access to contraception, being one of the 6 countries in Africa that has registered an increase in access and use of contraceptives in the past 12 years. This development was revealed by a key global family planning report launched recently by FP 2030. Burkina Faso, Uganda, Mozambique and Sierra Leone are some of the countries to have achieved the family planning feat. Women in Malawi have roughly double the rate of modern contraceptives use of 58% when compared with women across the rest of sub-Saharan Africa with 29%. Now, this access and use of contraception has helped Malawi improve women's health and socioeconomic well-being. The country has faced significant hurdles in its journey to improve access to family planning. Now, to discuss this, we are joined by Maziko Matemba, Executive Director, HREP Malawi. He joins us from Lilongwe, Malawi. Maziko, you are welcome. Good morning.
Good morning. Thank you. How are you?
I'm very fine. Thank you very much. So,
thank you.
How has Malawi become a leader in Africa in providing women with access to contraceptive? How did this begin, and what initiatives have been implemented to achieve this?
First of all, yes, indeed, want to congratulate my country, Malawi, for reaching this feat. It's not easy looking at country. As you know, countries sign off to many protocols, the Maputo Protocol and other protocol, to make sure that there is an increase in access in family planning methods. For Malawi, I think one of the achievements has happened because, you know, we have had opportunity of having support from development partners, but also there's been an increase in advocacy, a growing initiative by youth and civil society, but also development partners, as I mentioned earlier, in spreading the message, but also advocating in terms of the use of family planning methods. It hasn't been easy, but I think the issue has been because of the support which we have received from development partners, but also the openness of the civil society and the youth themselves. Because as you know, we have had issues around issues of youth health-friendly services, which was a challenge before 12 years ago. I think currently, the youth are able to demand access to these services. So it has been a number of effort, but also a number of initiative amongst, but also adding to this, Ministry of Health has developed a number of strategies on how we can mitigate, but also can ease access to family planning methods.
Okay, so Maziko, what specific benefits have women in Malawi experienced as a result of this increased access to contraceptives for family planning?
The benefits are many. One, it means that our girl child will be able to remain in school and be able to be productive. Because if maybe they got pregnant early, it means their future is jeopardized. They might not be able to access school because, you know, once one is pregnant, having children is very difficult to want to continue school, even though others do, but others. But also another benefit is that with the country will be able to save a lot of resources, because if you have many children which are born at a younger age, it means the country will have challenges in terms of meeting the social protection programs, so that we can be able to meet the demand of these youth and these young women. So the benefits are many for the country, and that's why I think Malawi currently, as you are aware, is hosting the Africa Population and Development Conference 2024, which is also highlighting some of these issues, and also to see to it how can we share best practices with other countries moving forward.
We also hear that there's a positive impact on women's health and overall well-being. In what ways exactly have the improved access to contraceptives helped in that aspect?
Yes, it has helped a lot, and it's helping. Even though I must say that being an advocate, an activist, I think yes, even though there's been an improvement, but we still have some pockets of high fertility rate among women, which is also concerning because it's an area also we need to work on. But what's most important thing is that, yes, indeed, there have been a sharp increase in terms of family planning use. So what we are urging is to make sure that Malawi being on course, because family planning is one of the key driver or key agenda for Malawi 2063 agenda, MIP1, that is implementation in the 10 years. So for us to meet this feat, it means we're also meeting our own national goals of women and children health.
Okay, then. So What are some of the key challenges that women still face, however, even if this is a positive thing? Are there other challenges that women in Malawi still face when it comes to family planning?
Yes, we still have challenges, pockets of challenges. One, to increase awareness on young women about the use of family planning at the younger age. But also some of the key challenges is also multi-sectoral engagement. We have education sector, which has got its own policies and laws, which maybe inhibits young girls to access family planning. So those are other areas which you are still working with government and the Ministry of Health and also the Ministry of Finance, which are hosting the population and development, so that we should be able to meet the demands but also the targets which we have set ourselves, but also at the moment you were able to meet some of those making such progress.
Well, thank you very much, Maziko Mathemba, for joining us and also giving us some insight into how this has been very good for women in Malawi. Thank you indeed.
Thank you so much for having me. Thank you.
You're welcome.